welcome back to my channel. It's your girl Ebony, where we're all things nursing, cooking, and lifestyle. If you're new to my channel, hey boo hey, and if you like this video or any of my other videos, please don't hesitate to subscribe, like, and tell a friend. So as you can tell by the title, your girl passed the first semester of nursing school. I'm so excited about it. It was definitely difficult. It was not easy, but I made it through, and I just wanted to give this video to y'all so you can just kind of know what to expect when you start nursing school. Every school is different, so it may vary a little bit, but this, what I'm going to give you, is kind of how it goes for most part from the videos that I've seen on fundamentals. I tried to watch as many videos as I could before I started so I could be prepared. So what I'm going to give you today is kind of how it's going to go, and it may vary a little bit. So let's just jump into it. So before we start, I just want to give you guys what I actually made in the course. So for my nursing program, a 75% is passing. So you don't have to get a 75% in each category, just a 75% average grade at the end. So my average grade at the end was an 80.66. So I was about an 81. I was very close to that 75, but honey, I made it, okay? I made a B. I really wanted to make an A, but I'm kind of getting the flow of things. So this semester coming up, which starts like in just a few days, which is summer semester for me, I'm going to try to, take what I learned from this semester to apply it to next semester, and hopefully I'll get an A this next semester. So let me just go over the breakdown of what exactly I made in this class. So we had 5 tests, not including the final, and the tests were worth 55% of our grade. So for my test average, I had a 76.2 test average, so it was barely passing that 75, which, like I said, each category does not have to be above 75, just the average at the end has to equal out to 75 or higher. So my test average, 76.2%. We had a case study, which was on diabetes, and that was 5% of our grade, and I made 100 on that, so I got all 5 points. Professionalism / work ethics, I got 4 out of the 5 points, so that means I made an 80% for that. So that was 5 points of our grade as well. We had a group project, which was 5% of our grade. Our group made 100, so I got all 5 points on that. Final, which was comprehensive over everything we had learned, I made an 83 on that. So my total average was an 80.66 at the end, so I passed. So for the most part, in your fundamentals class, it's going to be 3 parts. You're going to have the lecture, you're going to have lab, and you're going to have clinicals. Those are the 3 parts of the class. And like I think I told you guys this too, pharmacology, we don't have a class for pharmacology. Pharmacology is just in each course. So we get a little bit of math and a little bit of medications each semester, just embedded throughout the whole 6 semesters of our nursing program. So that's usually how it is: your lecture, your skills lab, and your clinical. So I'm going to break down, what to expect and how to go about succeeding in all 3 of those areas. So lecture is just basically what it sounds like. This is where you're getting the foundation of what you're learning in fundamentals. This is about the nursing process, the ADPI. This is talking about how to communicate with your patients. This is about certain body systems like the urinary system and how how the elimination works, and just things of that sort. A little bit into heart and circulatory, just a little bit of that. But basically, it's your foundation. In this lecture, you're learning about what's going to be on that test and what you need to take out from this this course, basically. So for me, what I did to kind of study was I recorded the lecture. I audio recorded the lecture, and some schools are different. You may not be able to do that. Just check with your school rules so you won't be in any problems with your school, honey. But our school allowed it, so I audio recorded the lectures. And so when I have an hour drive, so on my way there or on my way back, either one, sometimes, most of the time, I would listen to the lecture, and of course I would listen to it even more, just keep on repeating it the closer my test came. So that's a very good tip, because sometimes you miss things that they say. Sometimes lecture can be up to 4 hours, up to 5 hours, up to 6 hours, depending on your school. Mine was usually 4 hours. And you can get bored listening to them people. You can get bored of hearing, you know, their stories. They love to add, you know, the professors, the instructors, they love to add, you know, their experience in it, which is, you know, good sometimes. But sometimes you get bored. I mean, any human would. So it's good to record it if you can, so that you can go back and be like, oh, I missed that, I didn't even hear them say that, and it can kind of click with you better. How I studied for this class was practice questions. This is your very first nursing class. You have never experienced a class like this. You have never experienced any tests like this, unless you've, you know, been a nurse before and you're moving on to get your BSN or your MSN or whatever, your doctorate. But for the most part, most of us, we've never seen these type style questions. We're not used to the way they're worded. So the best way to prepare yourself for the first test is to do practice questions, so you can see what they're looking for. You can just Google NCLEX style questions for nursing fundamentals even before you start, so you can see what you're getting into and not bomb your first test like I kind of did. Like, I barely passed that test. So yeah, just do that. That's the best way. That's how I studied. I kind of read my book afterward, you know, while I was studying, but the main thing I did was doing the practice questions. I also had a study group, which they were amazing. I love my study group. If y'all watching this, hey y'all, I love y'all. But yeah, they were very helpful, and we studied together. We went through that textbook, and that's really why I don't think I read the textbook on my own, because I knew my study group, we were going to go through each page of, you know, the chapters that were going to be on the test, and we went through it. And, you know, when you're hearing other people put their input in, or remember it this way, or this is a good way to, you know, understand this, it's really helpful. Sometimes your professor is not always the best teacher, because they've been through this, they know this stuff. So it's just like that. Sometimes they can just spit out information and expect you to get it, but when you have your classmates with you, they can kind of explain it in, you know, to our level, which was so helpful. So that's what I recommend for a lecture. Just record it if you can, listen to the recording, get you a study group, and really with that study group, y'all study together. And what else? Do the practice questions. So the second part of nursing school, nursing fundamentals I should say, is your lab, your skills lab. So basically this is the class where you are learning your skills. So you're learning which some schools, like my school, require all of us to be CNA. So our very first checkoff was vital signs. So we were expected to know the vital signs, how to do them correctly, and basically actually not even just vital signs, all the skills that we learned, they showed us one time, and they gave us a piece of paper with all the steps on it, and you're gonna get tested on it that next week, and you need to be ready. You only have 2 attempts to take it. That's for my school. You have 2 attempts to do your checkoff, and if you don't pass that second time, you're out of the program. So it's very important to get your skills down packed. So some of the skills I'm thinking of on the top of my head that you will be checked off on, or you may be checked off on your first semester, is sub-Q and IM injections. Of course, vital signs, NG tubes, suctioning, you know. What else did we learn? Inserting a catheter and taking out, removing a catheter, making a sterile field, and how to make sure you put on the gloves the right way without touching all on stuff, because it's sterile procedure. Those are the most of them that I can think of. But stuff like your basic skills, you know, the basic things that you're going to be doing on a day-to-day basis, and they want you to get that down packed. So I think this semester, which is my first part of med-surg, we're going to be doing IVs. So I think IVs and maybe something else. So the first semester are kind of just like basic skills that you can kind of hurry up and catch on and get checked off and move on. So that's what you need to expect for that. The best advice I can give you on your checkoffs is to practice, 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 practice. If your school, they should give you a piece of paper and it has all the steps that they're going to check you off on, because it wouldn't be fair for them to be like, I want you to do this, but I'm not going to give you what steps you need in order to pass this. So most of the time they're going to give you a check off. Let me see if I can find mine. Hold on one second. Alright guys, so I got a check off from my school. So this check off is medication injection. So I'm just going to kind of bring it so y'all can see how it kind of looks. So basically, the first step is to check your medication against the original physician's order. Remove medication from Pyxis with instructor. The first check, perform right check comparing medication removed from the Pyxis drawer to the right order, so the right drug. Compare medication to the order, verifying right patient, drug, dosage, route, and time along with expiration date before closing Pyxis door. The third check is at bedside, using the barcode scanner to scan patient and medication. So, of course, you're not literally going to a Pyxis drawer and drawing out real medication unless you're at clinicals, because you will be checked off at clinicals as well. But for the most part, a lot of this is just, I know what I'm supposed to do. Kind of like a CNA, when you got checked off for your CNA, you have to verbalize the steps even if you're not really actually doing it, right? So the next thing, before you even go to the patient's room, you know you got the right medication, you got the right patient, you got the right drug, the right dose, the right time, everything like that, all your 6 checks. Then the second, or actually the very first step, is AIDET. So AIDET, which you'll learn in your fundamentals, is basically introducing yourself to the patient and telling them what you're going to be doing, assessing the room for safety, and washing your hands and saying, may I touch you? So that's basically, it's just, the AIDET is basically your intro when you're walking into the room. So that's the first thing on here. AIDET, you verify their name, their date of birth, and do you have any allergies or pain. You wash your hands and put on your gloves. So for IM injection, you're going to have to select 3cc syringe and 21 to 25 gauge, 1 to 1.5 inch needle. You prepare medication, drawing air into syringe equal to amount of fluid for injection. Withdraw medication, clearing all air. Use the scoop method to recap needle and changes needle if possible. Identifies IM injection site. So when you're doing your checkup, I'm reading this so y'all can kind of see how it goes. So some of the steps you're actually doing, like when you injection, you have a little injection pad. You get your needle, you're going to say, I'm going to use, for IM, I'm going to use a 21 to 25 gauge needle, 1 to 1.5, and 3 cc's of up to 3 cc's of medication in there. So you're going to have to actually pick out the needle, pick out the gauge, and you're going to have to drop that medication, which is not real medication. You're drawing up your medication in your needle, and you're going to tell them the site of the IM or sub-Q, whichever one it is. And you're going to say for IM, it'll be the deltoid, the vastus lateralis, or the ventral gluteal. So those are the 3 sites for those. So you'll tell them that, and so you'll get your injection pad, and you'll be like, I'm going to do it in the ventral gluteal today on this patient. You're going to get your medication that you just drew up in your needle, and you're going to show them how to do a 45 to 90 degree angle, and that's your checkoff basically. So this sheet of paper is so important for you to study when you're getting checked off. If your professors provide videos, make sure that the videos align with the checkoff sheet. If they, like, for example, my school provided a video and this sheet, but they made it very clear that this is the sheet that we're being checked off on. The video may help you, that's cool, you can watch it if you want to, but this is what you're being checked off on. I personally did not watch the videos because I didn't want to mess myself up, because it's easy to, when you're watching something, okay, I'm going to get into a rhythm of doing it like this and forget about this sheet. Now, if they give you a sheet and give you a video and say the video is how I want y'all to do it, not the sheet, then go by the video. Y'all see what I'm saying? Don't try to mix the both of them, which if they provide both, make sure they align so that you can watch either or, you know, whatever you prefer. So that's kind of how skills go, just kind of like the CNA, you know, getting your CNA test and doing the skills, getting checked off on skills. So the very last part of nursing fundamentals is clinicals. So my first semester, we only had 4 clinicals plus orientation. So we had to go to our site 5 times. The first time was like, I think 4 hours. And then the actual clinicals were all day. They were a whole 12 hours. Well, they weren't all 12 hours. They were like 7 a.m. to 5. We had to be there at 6:30. So 6:30 to 5. So almost 12 hours. Basically a whole shift. So for clinicals, this is where you're applying what you learned in lecture, all that foundation, all that knowledge, the theory behind nursing. And you're also adding in your lab, your skills lab, and you're applying it to real life people. So basically, it can be scary. It can be scary a little bit, especially your first day, because you're not knowing what to expect. You're kind of just thrown in there. Real nurses are needing your help. You know, some stuff I'm like, I don't know how to do that yet. And you have to tell them. You have to be upfront with them Like, I'm not able to do that. Most of the times your clinical instructor will say, my students are able to do this, 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 and this. Don't ask them to do nothing else. Or if they do ask you, you're going to have to be bold enough and say, I don't know how to do it. Because you can get in some trouble if you try to do something that you're not able to do yet. Or you can cause your school some trouble, if that makes sense. The best advice I can give you for your nursing fundamentals is to not be scared to get some knowledge. You know, talk to your nurses. It can be scary working with real nurses and in a real hospital setting, but take that time to ask them questions. How does this work? How does that work? Like I said, you're not going to know everything in there, so don't try to do everything, but it's stuff that you do know how to do, like taking vitals. One nurse came up to me and my friend that was in clinicals together. She was like, can y'all do these set of vitals? We weren't assigned to this person, but we went in there and we did it. You know what I'm saying? So it's just showing some type of interest in what you're doing. You're gonna be tired. It's just like working a regular job. They're gonna put you to work, but it's so good and it's so helpful to applying all the information that you learned and putting it actually into a real setting that you're going to probably be in a few years after you graduate. Another thing I recommend is kind of going to clinicals, not kind of, but going into clinicals prepared. So that means if you're not that good at this medication injection like I just went over, and I'm just doing this because this is what I found. Like, I don't have them all printed out, but just for example, the medication injection site, if you know you're not good at that and you've already been checked off on it, whatever you're checked off on, they expect you to do it at clinical. So if you're not too good at that, you need to practice, you need to memorize it before you go in there, and then your clinical instructor say, I need you to go give this injection to blah 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 patient, and you're like, oh, I don't really remember how to do it, I kind of forgot, I'm kind of rusty on it. So make sure you go in prepared with your skills. Also make sure you get some rest before. Like I said, you're up early and they're basically all day, a whole 12-hour shift for the most part, and it can be tiring. So make sure you get you enough rest and just go in prepared and be inquisitive. Make sure you ask questions to the nurses and make sure you talk to the CNAs there. You know, talk to anybody you can. Ask your instructor for help if you need help. They should be more than happy to help you, especially that we're in our first semester of nursing school. So yeah, for me, it wasn't all that hard. We went there, we did basic stuff, vital signs. We had maybe 4 to 5 patients, and one patient we were fully responsible for. So we went there, we did vital signs, and then we went and checked on our main patient and did a full assessment on them, head to toe assessment on them. We gave them full care. So, you know, baths and ambulating and anything that they needed help with, that was our responsibility for one person. And the other 3 or 4 patients that we had, we'll just do vital signs every few hours, you know, check on them if they needed anything. So it honestly was not that hard. It's a lot of learning that you do. It's a lot of on your toes. The nurses expect you to be on your A game, so you need to go in there knowing a little something. You don't know everything, but you go in there confident, and you ask questions when you need help on something. You don't just jump into something that you know you're not prepared for. So like that example I just gave you about, if you're not, you say you don't go in prepared and you're struggling on the medication injection, and your teacher says, your instructor says, I need you to go get this injection. You need to go right there and say, I am not ready. I know I did not come prepared, but yeah, I'm not feeling comfortable on doing that. Could you do it first and then I'll do it on another patient? Something like that. Because what you don't want to do is go in there and mess somebody up. You know what I mean? Like, these are real people. This is our profession. These are humans that we're taking care of. So it's very important to go in there prepared so that you don't have to get points docked on your, you know, your work ethics and your professionalism and, you know, just your, you know, passing clinicals. So yeah, guys, that is all for this video. If you guys have any questions about nursing fundamentals, please leave them in the comment section below. I'll be more than happy to answer them for you. Don't be scared. You know, you're gonna kill it. You're gonna have to study. It's hard work, but you can do it. I did it, so I know y'all can do it. Trust me, it's doable. So yeah, if you have any questions, like I said, put them in the comment section, and I'll see y'all in my next video.